Okay, well, welcome to the nursing rounds. And this nursing rounds is called Bridging Gaps, Perinatal Support for Racialized Immigrant Women's Project. And I first want to start by acknowledging the land upon which I sit, and I would encourage you to do the same. And I am sitting on the unceded territory of the Musqueam, Squamish, and Tsleil-Waututh people um, here in Vancouver. And I have large oak trees that are my caretakers. So I just, try to pick up after them. And I also have a cedar tree as well here on my property. So I live in the urban forest, and I'm really, really grateful to be able to do that. And I'm also really grateful and privileged to be amongst you all and at UBC. So today, I would like to introduce Dr. Jenny Auxier. And she is an assistant professor here in the School of Nursing. And her program of research aims to integrate elements of patient engagement into development, design, and quality assurance of perinatal digital health services. The core aspect of her research program is to meet new and expectant families where they are at in exploring the interplay between the burgeoning digitalization of health services and the important position of families in their adaptation. Dr. Auxier has lived and worked in the Netherlands and Finland, and now she's here with us at UBC. So, welcome, Dr. Auxier, and over to you.
Thank you, Sabrina. I can share my screen perhaps right now from the beginning, and I'd like to pick up a couple threads. First of all, let me know if you cannot see anyone, or maybe shake your head if you can see. Is that a better question? Nod your head if you can see. Yeah. Good, good, great start with the terminologies. So I'd like to pick up a thread, Sabrina, from your comment about the land in which we work. And I think it's fitting today that I took my bike to work through the forest near UBC and feeling connected to Mother Earth as well. Um, and I would like to recognize that although I work in the same space that you acknowledged, I think often of my ancestors who were buffalo hunters in the plains. It was the Cree Nation, so I think of them often as I do my work here. So I'd like to take a minute to think of that and recognize it as influencing the work I do, even though I spent a lot of time in Europe. And so there's also an addition to the title that I sent for advertising for this talk. I realized we had made an adjustment and I had used an old title. So we really do want to focus on the terminology of families rather than just specifically on women, although a super important part of the group that we want to reach with this project in the future. So at any point in my presentation, I'm quite happy to receive questions. We might find it as a normal structure in nursing rounds that we ask questions at the end, but I'll try to stay maybe Marilee, if you see any questions in the chat as we go, I'm happy to be interrupted. It's okay for me, but I won't be looking at the chat or the screen. So I'm going to get started. What I'd like to share with you all today is a project that I work together with S.U.C.C.E.S.S organization that's been around in the region since 2001, supporting immigrants and families in resources specific to immigrant populations. And we connected, I'm going to tell you the story of how we connected and that we applied for a CUES grant, Community Engagement Fund at UBC, and how that's gone for us so far and what we plan to do in the future together. This title page represents my model that I want to use in participatory action. Three-stage model represents families, and I like to keep the silhouette quite unspecific because we want to reach as many families as possible. And it's really hard to place a picture of families. It doesn't describe the reach that I hope to attain. And then there's a little image about representing resources in digital health use. So we'll get started through the presentation. Once I get myself there we go with my arrows. All right, the background, the story. What am I going to talk about today? I'm going to talk about the partnership and the commute. So the partnership began through a Zoom meeting that I attended in my first month, I think, physically living in Vancouver. About how to apply for a CUES fund, and there was lovely persons from S.U.C.C.E.S.S organization present at the Zoom meeting, and we connected immediately through the chat and noticed that we both kind of were looking for partners, and then from there our partnership began. We completed a application for the CUES grant, and it was not successful this year, but I'm going to talk to you about that proposal and what our plans are for the future. And so the community, I'm going to go over the community story. What are the important features of this community and organization? Where is the target population of work we hope to do in the first steps in my work with S.U.C.C.E.S.S? And one other thing that's kind of interesting is that I had contact with S.U.C.C.E.S.S when I worked as a clinical nurse educator in VCH, but in their work supporting long-term care populations. So that's interesting connect that I felt comfortable with the organization right off the bat. And then I'm going to discuss the conceptual model for action throughout this presentation. There's going to be a little bit more at the end, also about my future visions and steps related to my program of research as a whole. So project goals is a good place to start. When the team, through the Multicultural Childhood Development subsection of S.U.C.C.E.S.S, when that team connected with me and we had meetings, we put together this vision for our project goals together when we applied for the CUES grant. In November is when we sent that application. So our project goals were to partner with immigrant families who've used perinatal services in the Tri-Cities area. And then to better understand the present, and this is in quotations because it's tied to definition of access in the conceptual work that I have built into my program of research. So to better understand the present ability of immigrant parents to obtain the necessary informational or institutional resources with some level of confidence in the consistency of their availability. And then to co-design a resource to improve access. The partnership. It's a little redundant. You know that I'm the one giving the presentation, but I'm in partnership and I'd like to represent this exciting moment for me that I've moved back to BC and been able to connect with people who are living and working with communities in an area that I'm semi-familiar with, but not that familiar with. So it's exciting. This is a picture of Tri-Cities. This will be the area that we focus on when we work together. And then I wanted to just put the possible prospective name of my program of research as it stands now. It's the language I'm using, but I think there might be some evolution as we go. But for now, it's Parent and Family Health Engagement Program. So the community that we're focused on as a team has some particular needs. There was some work done right after the pandemic, and I'll pull that report and make it available to Marilee to share after my presentation. But there was a report that S.U.C.C.E.S.S worked well with their large table of experts in wellness for families. They had completed surveys and tried to understand the specific needs of their community. Very interesting work that they've already completed, and some of the findings related to the needs and specific challenges of this group in the Tri-Cities are immigrant families in this area actually need to leave the region for maternity care. There is not a hospital space and acute care very close by to the families in this region. So that's kind of an interesting concern in this particular living region in the Lower Mainland. There's also challenges accessing culturally appropriate perinatal services. That's goes beyond the Tri-Cities area for sure, but it's a specific focus for S.U.C.C.E.S.S and the community of families they work with. And then finally, racialized groups face disproportionately high impacts of perinatal mental health concerns. There's just layers of reasons why that's happening. And a lot of you in the crowd can sort of be familiar with the fact that immigrants specifically struggle with trying to adapt in a dominant culture that isn't their own. of origin. And what can happen is that there's so many other cultural steps and adaptation that are going on in their lives that it's quite hard to discern and find the nuances of accessing healthcare. So they there's sort of two effects that because it's so challenging to adapt, you already are at risk for mental health concerns and difficulties, especially if you've moved countries and you're not with your entire family. There's aspects of loneliness that come into play. And which is something I've studied in the past. But as you know, I mean, I've experienced it when I moved to Europe myself and learned the language there and lived there for 7 years. So there's something that really goes on when you adapt in a new dominant culture that can influence your mental health. And then further, because of the cultural differences and lack of maybe understanding nuances in the structures of the dominant culture, it's very difficult to access culturally relevant and user-friendly perinatal services. Okay. Well, I'd like to discuss with you folks my conceptual model for action, and I'm not going to go into such the detail on all these pieces here, but it's good to look at it because I get drawn back into my model that I worked on in my doctoral program over and over again. I've have a submission sent to Nursing Inquiry. We see how it goes to describe the interpretive synthesis work that I've done to explain this model. But in this presentation, I want to focus on the fact that everything I want to work on in the group with success is related to person-centered perinatal care and parent practices. What are the parents doing? How are they working towards their own care coordination and self-management? And it relates to how these concepts tie together. So if we want to have conversations offline, I'm happy to talk about my model at length, but today I'm going to bring our focus to after I shared my model with the group in S.U.C.C.E.S.S, they were very excited. They were interested in it. What's really wonderful is if you can find overlap in the ways of thinking about care and added value, they really saw this model as a helpful stepping stone towards articulating some of the needs in the community. So to bring our focus as a group today in my talk towards something that's digestible and workable for the moment, it is provision of information and access. So these two pieces tie together and they're linked back to person-centered perinatal care. Sometimes I'm referring to as parent practices in perinatal digital services as the core piece. All right. So the steps that we took as a group were to look at the three phases of the participatory action model that we want to use. The key thing to remember is that it doesn't have to be going in steps that are, well, stepwise. It's very iterative, like most of these participatory action models present as. We don't want to be so strict with which steps you take. And so just to point out here that as a group between me and the S.U.C.C.E.S.S members who are interested in working together to promote wellness in immigrant family situations and accessing perinatal services, we wanted to start with person-centered mapping. And then we would move to co-creation and real-life use of digital services. And there's some options for the group now, things that already exist that we can start applying. So for example, Perinatal Services Hub that's patient-facing. We were interested to see how the immigrant families experience using that service and what they see as useful, what works well for them, and then what might be the pieces or gaps that they see in that program. There's also a possibility of doing what's called a design probe and sharing with them what a service would be like that's been used in Ireland with one of my partners, which I'll share later about. So we could bring that in and discuss with them what it would be like to use a resource like this that has a little bit of agentic AI in place. So the co-creation phase will happen with S.U.C.C.E.S.S as well, using various digital services that already exist, relating to improving their access and also watching how access unfolds as an adaptive process for families. And the third, we would integrate process evaluation as the next step. So I'm going to pull away from that project and just talk about why this work is useful outside of my fascination and S.U.C.C.E.S.S fascination with using the model for participatory action. And as I started to dive in a little but didn't get into the nuances and details, why I want to look at practices and adaptation when folks are accessing services. So I'll tell you a little bit more about that. But we're excited for our own reasons to get involved in this project. But what's really exciting is that there are wider health strategies within British Columbia specifically. Recently, there was a rapid review conducted through a team in Women's Health Research Institute. And one of their themes, there are many that came out of this rapid review, but one of the themes is increased patient autonomy and support to navigate health system throughout the continuum of perinatal care. So it's really exciting that folks are talking about this as a direction that we need to take in healthcare and health professionals and in community supports to promote exactly the pieces that S.U.C.C.E.S.S is interested in and that I'm interested in my program of research. So this relates to the provision of information and access to services, resources, and support. Further, there are wider societal strategies and goals at play here. During my doctoral study, I gained information through a scoping review and explored through a feasibility study what it means to have parents engaging in perinatal practices using digital services. It's a wide topic. I focus specifically in exploring access as that process of adaptation, which I alluded to already in this presentation. The piece about watching adaptation happen through real life practices and monitoring real life experiences using human-centered design approaches for investigation and methods can help us understand how society as a whole can use what's already present in their activities in digital use. What are the strengths that they already have in receiving resources that they need? So what I found from the scoping review is that we're missing process evaluation, and I would like to look at process as a practice and watch how folks adapt with using digital services. And so this is a piece that I hope will travel with me throughout my program of research, and we just tap into it a little bit, dip our toes into it a little bit with working in the group with S.U.C.C.E.S.S. What they would like to measure is how do we improve access through metrics that exist already and are quite easy to articulate to policymakers and other members of their expert panels in providing wellness to the community. And so those metrics are, for example, usage data. How often are folks accessing services? And then how much are they accessing resources such as acute care or community resource clinics? This is helpful at a certain level, but the work that I did in my PhD shows us that we would want to look more at the nuances and how folks adapt in the new age of taking on more digital technology and looking at process evaluation rather than metrics of usage for helping us understand access. We do need those metrics to start. And for example, I'd be interested in doing some epidemiological studies to understand how is perinatal care being accessed maybe through primary care avenue. So those are important starting places, but as I work through my program of research, I'm really excited to get into the details and nuances about how folks practice while they gain access. So one way to capture that, I can explain it at length because I enjoy talking about it, but sometimes we lose the thread because I get quite excited about the nuance, but I want it to be clear to you folks here today. One of the best ways to start having conversations about access before we start saying which technology will we use, who's accessing, where should the access be? Is it in non-for-profit organizations who provide support such as S.U.C.C.E.S.S? Is it Perinatal Services BC that provides the resource, or is it our hospitals and maternity wards? Before we get into those questions, one of the first things to ask on a general level to anyone who wants to engage in the research that the team will be working on is what resources and information do you need to receive the right care and health services for yourself and your family? I hope to extend this question to any relevant population. At the moment, where my expertise lies is parents who experience care of an infant in the NICU and have come home after that kind of experience, or parents who've experienced care in maternity units and come home with their new baby, or parents who have had toddlers for a couple of years and are still trying to navigate systems and provide holistic care for them and their family down the line. So this question is a nice key in beginning discussions in knowledge translation sessions, for example. Next steps. So we're going to begin knowledge translation sessions in the best form that suits the community. I'm going to work with S.U.C.C.E.S.S and find out how often would they like to have meetings where I start to build connections and folks start to get to know me as a researcher in the community and the expert panels that already exist with S.U.C.C.E.S.S and their partners. And of course, the veteran parents and folks who've experienced care or have lived experience, experts is what we would call them. I want to figure out how best to engage with the community. So we're in talks now to decide how best that works. So for example, I'm going to be in a different community and panel that I'm working with family health engagement is at Surrey Memorial Hospital in connection with Ronald McDonald House. And we're going to be doing every Monday for a while, having open house type sessions and discussions with parents who come into the family room at Surrey Memorial. So that's one structure, but I'm looking forward to seeing what S.U.C.C.E.S.S would like to do with KT work in the coming months. And one of the things that kind of came across my mind through discussions with mentors and experts in research in our department is that perhaps I want to consider thinking about how coordination of care ties to the work that we're doing right now. And this first project idea, I think, can spark a direction that helps us translate the work we're doing to healthcare policymakers and other folks within the university research community, and more broadly, as coordination of care is a relevant topic when it comes to digital health service innovation. So those are some of these steps now and thoughts. And I'd like to just let you all know who I'm starting to work with so you can understand a little bit what I'm getting at when I say I want to understand access through an adaptation process will be looked at through it's previously been talked about and may be familiar to you if I say medical anthropology lens, but I'd like to make that more broad. Maybe we find terms to describe anthropology and nursing science, but I'm working with these folks to look at use of technology from a different angle, using my nursing expertise and working with Olga as it's relevant. Olga has an expertise in what's called actor network theory and thinking about complexities and looking at practices and the nuances that occur in work. So I'm interested in parents' work and parents' practices while they try to receive access and adapt to using digital technology. And then these other folks, we started some conversations and started some relationships to apply for some grants together related to angenic AI, which is that word is the root agent. And so it's Matt Ratto is an expert and has a lab about how to best apply the use of AI as an agent in healthcare services, but using grounded in ethical principles. And we could harmonize the work with my participatory action and user-centered design and human-computer interaction design with Kevin, who works in Ireland. So these are the folks who help to inform those steps I'd like to take next with local groups. And this slide helps me try to tie together all the nuance, and I mean, I would try to say a bit of nerdy way I go with my conceptualization. I'd like to put it together in a way I think might fit in your minds well. So if we think back to the strategic goal within British Columbia, specifically about increasing patient autonomy and support to navigate health systems through the continuum of perinatal care using digital services. That's the piece. I want to look at practices and work of coordinating care for families and parents. What are those practices, right? So we can measure how we increase autonomy, but I would tell you that the team who has this theme, there's sub goals under this theme, and one of them is to decide how we'd like to measure autonomy. And how do we then understand how folks are navigating in a system in order to coordinate their care, we look at the processes. And so I want to watch practices and work of families as they unfold in digital. As digitalization of healthcare is increasing, we want to harness and leverage the interest and benefits of using digital technology without forgetting to look at the nuance and find out what's that hidden work that families and parents are doing. And so we're going to be interested to see how parents adapt or are interested at all, perhaps not, with this agentic AI tools that exist. Something called ecological momentary assessment, which is a way of collecting data using wearable devices. And the data is collected 24/7 in some cases in order to find patterns and help in tandem with AI tools to give parents the resources they need in real time. But again, when parents find this kind of technology relevant, it'd be great to test these kind of things in real time to see if the adaptation process is useful to them or if it creates more barriers. That type of investigation is very important. Human-computer interaction methods will be core of the next steps I take with various teams and with S.U.C.C.E.S.S. And the social material lens and actor network theory are my favorites when it comes to thinking about how we examine practices and the work that families and parents will do in coordinating their own care, and of course in partnership with healthcare providers and experts. And just to wrap it up, my biggest questions of curiosity for the future is that I hope to answer some questions about the how of technology use and technology integration within these systems of perinatal care, and for whom questions. Who does it work for and whom might it not work for? So that's my talk for you today. And I want to share with you my favorite family members. When we ask questions, I sometimes think of their faces. So if anybody has questions, we can leave the screen up for a bit and you can look at my lovely cats while we might have more discussion about my work. Thank you for your attention.